little bit after 3:30 on October 29th. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us. Today we have with us Nita Ludwig of the Rock Island County Health Department and Amy Thoreson of the Scott County Health Department. We will be talking about safer trick-or-treating and Halloween activities and safer voting procedures. First of all, though, let's start off with some numbers. Nita, can you talk about Rock Island County numbers, please?
Sure. Today in Rock Island County, we have 67 new cases of COVID-19, and that brings our total to 4,364 total cases in Rock Island County. Deaths remain at 101. I did want to take just a moment to remind everyone that the state drive-through free testing site will be here this weekend, October 31st and November 1st at the Camden Center in Milan from 9 a.m. to 5 p.m. Thank you.
The Iowa Department of Public Health is reporting 4,835 cases of COVID-19 in Scott County residents. There have also been 42 deaths. The most recent death was an elderly adult over the age of 80. We extend our sympathies to this individual's family and friends on the loss of their loved one. I would also like to mention that the Test Iowa location in Scott County is moving indoors. It will still be at North Park Mall. You can still follow all the directions that are marked to get there, but it will be moving indoors because of the fall and winter weather.
Thank you, Nita and Amy. Nita, let's talk a little bit about safer Halloween traditions.
Sure. Halloween and the presidential election, of course, just around the corner, and has been the case for most of 2020. COVID-19 will play a role in both of these events in our community. Please do your best to minimize the spread of COVID-19 as you participate in these activities. For Halloween, there is still time to plan for low-risk Halloween activities, such as a scavenger hunt style trick-or-treat with your household members in or around your home, car parade, one-way trick-or-treating where you surprise family or friends with pre-wrapped Halloween goodie bags on their front porch. And for those wishing to trick-or-treat or trunk-or-treat, be sure to wear a protective mask, either instead or under your Halloween mask. Trick-or-treat with a member of your household only. Limit the number of houses or trunks that you visit. And do not crowd at the door. Give yourself space between other groups. Stay local. Avoid the urge to attend events in other towns. Use hand sanitizer before eating any candy, and as needed, of course. If you're still wishing to pass out candy for trick-or-treaters, you should remember that children frequently show mild symptoms when they are infected with COVID-19. And instead of handing out candy face-to-face, set up treat stations at least 6 feet from your door. Wash your hands for at least 20 seconds before placing any candy, and the table when refilling. Better yet, you could also leave individually wrapped candies on your front porch or sidewalk with places to spread out to limit interaction with trick-or-treaters. I know a friend of mine personally developed a big PVC pipe that you can shoot candy down to the children. So that was a very innovative idea to do that. And wear a proper face mask. A costume mask, such as those worn for Halloween, is not a substitute for a face covering. If face coverings are worn under the costume mask, please ensure that this does not create any breathing problems, and if so, discard the costume mask. Due to the high spread of COVID-19 in our community right now, we discourage any Halloween social gatherings that involve large groups of people. Large gatherings with more people are considered higher risk, and rather than small group gatherings. Any indoor parties or gatherings, no matter how large or small, should include social distancing, wearing masks, and hand washing. The more time you spend at a gathering, the closer the contact, and the more the people, the higher your risk of exposure to COVID-19. If you did participate in any higher risk activities after Halloween and you feel symptoms, you should stay home as much as possible. Avoid being around people at increased risk for severe illness from COVID-19, and consider getting tested for COVID-19 and then stay home until you know your result. And now Amy will talk about the election coming up.
Tuesday, November 3rd is Election Day. Local officials are experiencing high early voting turnout and are expecting the same at the polls on Election Day. To minimize your risk of exposure to COVID-19, there is still time to take advantage of in-person early voting. In Scott County, early voting is available through Sunday, November 1st at most early voting satellite locations, and through Monday, November 2nd at the Scott County Auditor's Office, which is located in the Scott County Administrative Center at 600 West 4th Street in Davenport. In Rock Island County, voters can vote through Monday, November 2nd at the Rock Island County Clerk's Office, which is located in the Rock Island County Building at 1504 3rd Avenue in Rock Island. The only off-site early voting location in Rock Island County is at Western Illinois University at 3300 River Drive in Moline, and that's through October 30th. More than 37,000 Rock Island County voters have already cast their ballots. In Scott County, more than 54,000 have already voted. In Scott County, ballots can still be returned at any of the drop boxes at any early voting site. Whether you vote early or on Election Day, make sure to do so safely. If you are able, consider voting at non-peak times when crowds will be smaller and it will be easier to social distance. Early mornings and the end of the day are expected to be busier than during work hours. Make sure you wear a mask when you are in line, when you're talking to poll workers, and when voting. As much as possible, keep 6 feet of distance between yourself and others. Follow the directions of the elections officials. They are taking steps to limit the number of individuals in polling locations at one time. Bring hand sanitizer and use it. And please stay home if you're sick. Because of the close distance you may have to others, if you have COVID-19, there's a good chance that you could be exposing others to the virus in this type of situation. Contact local election officials if you have questions about voting options or unique situations. We want to thank our local election officials for all of the planning that they have done, taking into account COVID-19 safety precautions. We know that safety during this type of an event will require each of us to do our part too. As we've said before, we're in this together, and the actions that we each take impact the others in our community.
Thank you, Amy and Nita, very much for sharing that information. Just wanted to get that in before Halloween on Saturday and before the election on Tuesday. We have had a couple of questions that came to us ahead of time, and we do have another question that has posted. So I'll start with the ones that came ahead of time. Scott County has a higher case count, but Rock Island County has more than double the death count. How does each county attribute the deaths to COVID? And are the hospitals or the doctors the ones that give the cause of death? Nita, do you want to address that first for Rock Island County?
Sure. For Rock Island County, we kind of triple verify the deaths. So sometimes we will get the call from the hospital or long-term care facility, and they will let us know that a patient has passed away of COVID. And then we always double check with our the death certificate when it comes in to be sure that we are reporting it correctly. And we also work with our State Department of Vital Records on that as well.
Amy, do you want to describe it for Scott County?
In Scott County, we are notified sometimes by a provider or the hospital of a death, but those deaths aren't on the state website or announced until the death certificate is finalized. The death certificate is finalized by a medical provider and then given to the Bureau of Vital Statistics or Vital Records at the Iowa Department of Public Health. We don't manage vital records here locally. That's done by the recorder's office. So we announce those deaths once the death certificate has been finalized and includes COVID-19 as the cause of death or a contributing factor in that death.
And Nita, as a follow-up, do we have a reason or something that we suspect behind the higher death rate in Rock Island County, considering the cases? Scott County currently has higher case counts.
Yeah, I don't think that there is an answer to that as of yet. You know, all we know are the deaths that we have been reported. That's really all I can say.
The next question that's typed into the chat, this is for Scott County related to our long-term care facilities. The Iowa Department of Public Health website on coronavirus.iowa.gov shows cases, and it also shows recoveries. When the facility has no active cases, it disappears from the website since it's no longer in outbreak status. Have any Scott County residents of long-term care centers been reported as a COVID-19 death or deaths?
Yes, we have seen deaths out of our long-term care facilities, particularly those that have had outbreaks.
Okay. Sorry, I'm just going through the questions here, making sure I get them all. For both counties, what are the trends you are seeing in the number of cases compared to hospitalizations? And are case numbers compared to the number of deaths? How many? Do you want to speak first to hospitalizations? What are we seeing with our case numbers, as well as what we're hearing from our contact tracing? Nita, you want to start?
Yeah, I don't know that I would have a really good answer for that as well. Our contact tracers are certainly working the cases, and sometimes, you know, maybe after they have made an initial contact, the person might get more ill and end up in the hospital. So I don't know that I can really give a good comparison on that. And the same with the number of deaths. I mean, we do report, when we report the deaths, we do report whether it was in a hospital or a long-term care facility or the person's home. But other than that, I don't have any other information.
I think
Any thoughts on that, Amy?
Yeah, whenever we see increased cases, we then see increased hospitalizations, and then we see increased deaths. We know that we're at record high numbers this month of October, and we've had our highest total of deaths in October. So those trends go up, and we see more people get really sick, and then unfortunately we see increased deaths as well.
Next question about repeating where the in-person early voting is for Scott County. We didn't provide the locations, but if you go onto the Scott County, Iowa website under the auditor's office, on the front page, it does give the exact dates, times, and locations of all of the early voting that takes place, and individuals can also look up where their polling place is. So that might be best to grab it that way. Amy, this is not how we report deaths. Are we able to report anything about Scott County residents at long-term care facilities that have died, and which ones?
I would have to get back to you. I don't have those numbers right at my hand, and I need to verify what information we can share on those deaths.
Another question for you, Nita. Region 2 in Illinois is now totally surrounded by regions that have or will have mitigations in place. Should this ring some alarm bells for our region, knowing that those mitigations are more than likely impending for us?
Yes, well, I would say we have been trying to ring the alarm bells for quite some time now, and we have been saying the last two and a half months that our cases have just gone up and up, and our county has certainly been in the warning level several weeks in the last couple of months, and it is serious, and we really need people to heed the public health measures that we say every time, which is the 3 W's: wash your hands, watch your distance, and wear your mask. And it's so important for people to follow those precautions. We do not have any other tools in our toolbox right now, so those are the best ones we can use to slow the spread of this virus and get our numbers back down.
It says, is the virus spreading more within households now? Amy, do you know what we're seeing within our contact tracing?
Well, we've seen household spread throughout this entire pandemic situation. We know that the individuals that we live with were in most close contact with were likely not wearing masks and social distancing at home. So it's very common for us to see entire families become infected with this virus, sometimes all at the same time because they were at an event and were exposed to the same individual. Sometimes one or two starts to have symptoms and then 3 or 4 follow about a week later. So household spread has been very common throughout this entire pandemic.
Okay, we'll go ahead and conclude, seeing no additional questions. Again, this is recorded. It will be posted on the Scott County Health Department's website and will be shared by our social media pages. And please be looking for the press release that will be sent out after this. We do not anticipate holding a briefing next Tuesday with the elections, knowing that you all will have lots that you're covering. Due to that, should there be any new information we need to share, we will make sure to get that out to you. But we will plan on talking with you again later next week. Thank you, everybody. Have a good afternoon and a good weekend.